Okay, we are live. We are live. Welcome tonight, you guys, to the internal work of love. And I'll give you guys a few moments to get the notification and log in. Thank you for joining us tonight, and for those who catch this on replay. I am Betty Fisher, host, founder, and transformation coach of this broadcast and this segment. And tonight we are going to have a community conversation about COVID-19. So all of the myths and the questions you guys have will be explained tonight with my guest, Dr. Loren Hamel. And I have Mrs. Bertha King here with me as well. And so join us, learn tonight. We're going to calm your fears, but let you know seriously, there is something that our community have to understand that this is serious and it is a health emergency, that we be safe, that we learn what we need to do to stay healthy and to stay alive. So thank you guys for joining tonight. And those who catch this on replay, we're going to give you a couple of minutes to get the notification and join us tonight. So welcome, welcome, welcome. Make sure to share this as well. Tag your friends, share it on your platforms. Let everyone know we are live tonight. And Dr. Loren Hamel is going to answer the questions that everyone have and let you know the severity of our community understanding the health risks of this virus. So, and once you are there, please let me know you're there. Give me a wave in the comment box to let me know that you are there, and please share it. Las Vegas is in the house. Awesome sauce, Dolly. Thank you for joining tonight. Wavy, thank you. Thank you, guys. Let me know that you are there. Wave, a thumbs up, a hello. Please, yes, thank you for sharing, Lacey. Thank you for sharing, Wavy. Please share this, you guys. Let everyone know that we are live tonight and we're going to have a conversation about this health risk. Hello, Whitney. Thank you for joining. Laura Lee, thank you for joining. Please share this as you guys come on. Hello, Shane. Thank you for joining. Thank you guys for joining us tonight. Thank you guys. Thank you. Thank you. Everyone for joining us. So I'm going to introduce my guest, special guest tonight, and I'm super excited and I'm honored to have you on this platform. And I was a little nervous about this. I was joking with Jerry earlier how nervous I was, and then once you came on, all the nerves just went away. They just went away. So thank you tonight for joining us. I am here with Dr. Loren Hamel, and he is the president of Spectrum Lakeland. So if you guys can wave and tell Dr. Loren, hey, good evening. I am also here tonight. Thank you. I'm here tonight with Mrs. Bertha King, and she is the co-founder of Strong Women of Faith. So if you guys can wave, I think it's some people here who knows you, Bertha. Thank you guys for joining tonight. And we're not going to delay any time. So please share this and let everyone know that we are live. And also, if you catch this on replay, okay? I apologize for those who don't join in. We want to be considerate of the doctor's time and Mrs. Bertha King's time, okay? So thank you guys for joining us tonight. Dr. Loren, I want you to share what you do and what COVID-19 is about and how this impacts our community.
So thank you so much, Ms. Fisher, for inviting me onto your virtual broadcast here. It's a pleasure to be with you and my dear friend, Mrs. King. I appreciate that very much. So in my role at Spectrum Health, I help get the community ready for COVID-19 and to treat those that get the sickest. This is a disease that we all have heard about, but there's a lot of misperceptions. It's an incredibly important disease and something, if we do the right thing and take care of our communities, we can lessen that disease burden and ultimately save lives. You know, my mission in this is to do everything I can to save the lives of our dear friends and neighbors. That's the reason why I am just delighted to have a conversation with you and others, because it helps keep us all safer when we do that. You know, we all are part of a community. We all have families. I'm the father of 7 children and 9 grandchildren. I want to keep them all healthy. And I want to keep all my friends and neighbors around Berrien County healthy as well. So that's why I'm delighted to talk to you about COVID-19.
Thank you so much. And we are delighted to have you here. You guys, please share this as you come on. And Miss Bertha King, I want you to tell us about yourself and your mission of being here tonight as well.
Well, I'm here because I too want to see as many lives saved as possible. I've seen deaths occur among people that I know and the illness among people that I know. And I know that it's important for us to make a difference. I'm an author, motivational speaker, educator, and co-founder of Strong Women of Faith Breast Cancer Group. But among all things, I'm a servant. And a servant that makes a statement to the world that we are all important people and we are here to make a difference and not to stand on the sidelines and make long statements about how great we are. But it's important for us to be great at what we're trying to do to make a difference with others.
Awesome. Please share, you guys, as you come on. Thank you for joining tonight. So what basically is COVID-19, Dr. Loren? What is it and how does it spread?
COVID-19 is a virus in a family called coronavirus. That's a virus that can cause just a common cold when it's in its mild form, but COVID-19 is a particularly aggressive form of that virus. Now, this is a lot different than a flu for all kinds of reasons.
Mm-hmm.
The COVID virus can be transmitted when you don't even know you're sick. It can be transmitted for a few days before you have symptoms. It has a long incubation period, which means you may get exposed and not have the disease from anywhere from 2 to 14 days. And you can be contagious before you know you're sick with it. So it makes it kind of a uniquely dangerous virus. People often compare it with influenza or the common flu. Mm-hmm. Well, the common flu is spread the same way, no question about that. But the common flu, you get sick, everybody knows it, you know it, people stay away, you get better. With the COVID-19, you can spread it and not know it, and others can get it and spread it and not know it. Also, influenza tends to make people all about the same kind of sick. They all feel miserable. Some folks with COVID-19 don't even know they're sick, and others are dying.
Right.
So it makes it kind of a uniquely dangerous virus. And of course, you can tell that how it's spread around the world so quickly,
Right.
despite a lot of efforts to stop the virus.
Okay. Who is the most at risk for this virus?
Yes, certainly those that have chronic medical conditions are at much higher risk to have complications with the virus. Probably every age group is about equally susceptible to catch the virus. Every gender and every ethnicity is about the same, with some variations, about the same in their propensity to catch the virus. But there's a huge difference in how sick people get once they have that virus. And particularly as you have other chronic diseases like diabetes or heart disease or hypertension or chronic obstructive pulmonary disease, asthma, those kinds of chronic diseases make you much more susceptible to the complications. And as you get older, you're much more likely to have severe complications, including needing an ICU, needing a ventilator, or even dying. If you're less than 50, your chance of having those complications is actually pretty low. As you get over 50, it gets much, much higher. But there have been deaths from this virus in Michigan from as young as 20 to as old as 107. And there have been deaths across the world in very young children to very old individuals. But clearly, the older you are, the more chronic conditions you have, much more likely that you're going to have serious life-threatening complications.
Okay. How does one know that they have it?
Well,
has contracted the virus?
That's a really good question, Ms. Fisher. You know, it presents many different ways. The average individual with COVID-19 gets a fever, gets a cough, often dry, gets fatigue, maybe shortness of breath, maybe body aches. So that's average. But there's a lot of variations. Some folks that get COVID-19 don't know it at all. Some folks lose their taste or their smell. A few folks get diarrhea or sore throats, things that are not typical. The average is cough, shortness of breath, temperature, and sometimes fatigue and body aches.
Okay. What should you do if you think you have it?
Well,
or have been exposed to it? What should we do?
Yeah, so you need to call your physician or call the health department, and we will direct you to COVID-19 screening. And in fact, we do that screening often virtually. We can do that on the phone or with a video connection. The reason for that is to minimize exposure back and forth so folks aren't transmitting that germ to each other. But you call your healthcare provider, depending on how sick you are, depending on your history of exposure, you might be told a number of things. Yes, you probably have COVID-19, but you don't need medical care right now. Stay home and stay away from your friends and neighbors and family so you don't give it away. That's a perfectly fine recommendation. As you get more symptoms, you may be asked to come and get tested to have those that COVID-19 confirmed. And of course, if you get very sick, you belong in a hospital. But the first thing to do is pick up the phone and call your doctor. You can also link to our website at spectrumhealthlakeland.org. If you link to that website, we will give you a number where you can call and get screened for free.
Okay. Thank you guys for joining. For those who have just tuned in, I am here tonight with Dr. Loren Hamel and Mrs. Bertha King, and we are having a community conversation about COVID-19. And Dr. Loren is explaining the basics of this virus and what we need to do to protect ourselves. So please join us tonight. Share this, you guys. Let your timeline, your friends on Facebook know that we are live tonight. And if you catch this on replay, please view it in its entirety. So
I have a
what, Dr.
question.
Loren, what is Spectrum Health Lakeland doing to help the community stay safe?
Well, first, we're having conversations anywhere we can. We're happy to talk with our community and help share the kinds of things that might keep them safer. So that is certainly the most important part. About 80% of a community's risk for COVID-19 is what they're doing in their homes and what they're doing in their communities. About 20% of that is actually health care. Folks get sick enough to be seen by us. There are a whole lot of things we're doing inside the walls of our health systems. Here are a few of them. One is we now can see many conditions virtually. You know, so your doctor visit, your office visit is done virtually instead of in person. That's on a computer screen or a telephone with a video chat link. That helps keep everybody safe. We can do that quickly. We can do that inexpensively. And that helps keep those germs from spreading. That's new. In addition, you'll notice that everybody that comes to our hospital is screened for COVID-19 symptoms to make sure that they're completely safe coming in, that they're not likely to spread that germ to others or the staff. We also are following Governor Whitmer's executive order about limiting visitors. Now, it breaks our hearts to tell somebody, no, you can't come in the hospital to see your loved one. I mean, that is so challenging for us all. But we abide by that governor's order, and I think it's a good one. There was a lot of transmission for folks visiting loved ones in hospitals in other countries. You can take that virus home and give it away to your family, or you could bring that virus in and give it to healthcare workers. It is just so important to maintain that social distance everywhere, including in a hospital. And so you will notice that visitors get screened with just a few exceptions. If you're having a baby, you need somebody with you. You know, if you're a child coming to the hospital, you need a parent or a guardian to help provide the history. If you're in a near-death experience of some kind, if you're at the end of your life, having a family member show up has risks, but is something we try to accommodate. For almost all other circumstances, the governor's order says, no, you just can't visit anymore. In addition, we have worked hard to build our healthcare capacity. All the models run all across the country say we're likely in many communities to run out of hospital beds, to run out of ICU beds, to run out of ventilators. And of course, we don't want that to happen. And so we have done things to very significantly expand our capacity in case our community needs it. We now have 2 ICUs instead of 1. We have a lot of beds that have been placed in service just in case we have a surge of inpatient admissions. And of course, we've done everything we can to accumulate ventilators to take care of people that may get sick. So we're doing our best to get ready. I hope and pray none of that is necessary, but we're doing everything we can to make sure we can take great care of our friends and neighbors.
One thing you said in the beginning of your statement was you said that 80% of contracting the virus, the chances of it, is what we do at home.
So 80%
please elaborate on that.
Yeah, 80% of the fight is what is of this virus is not the drugs we're using in a hospital. 80% of this fight is not ICU or ventilators. 80% of this fight is making sure we don't get sick in the first place. Make sure that's not transmitted. You know, it's a really simple math, actually very simple math. If everybody that got COVID-19 gave it away to, on average, less than 1 individual. So if you give it away to very few people, this goes away. If everybody that gets COVID-19 passes it to 2 individuals, this goes crazy in our community. If everybody that gets COVID-19 gives it away to 3 individuals, there's no way to stop it. We're going to exhaust every resource in our community. That's called the reproduction number, you know, and it's a measure of how that's transmitted across our community. So if we're careful in our communities not to spread this back and forth, this virus will go away. So that's way more important than what happens in the hospital.
So please explain the severity of how important it is right now for us to maintain social distance.
Well, the only thing that has been found successful to curtail this epidemic, the only thing is preventing transmission from person to person within the community. You know, and there are countries that have done more. China, they did a lot more. When somebody got sick, they arrested people out of their homes and put them in mandatory facilities. They had drones up telling people, wear your mask, go inside. They had ankle bracelets to track, you know, and we don't do that in a free society. China does those things, and that absolutely helped curtail this. Now, we can't do that in the United States, and Europe can't do that. But the countries that have been the most diligent on social distancing have curtailed this epidemic much more quickly. So we know that is a fact. I mean, there are other things that are important: testing and tracing. You know, we need to have enough tests. We now have more tests than we did, but not enough tests yet. As you know, in this country, we got a really slow start to how many tests we had available. Initially, we had to send them to the Centers for Disease Control in Atlanta and wait 2 days to get it back. Then we needed to send it to the state of Michigan and wait up to a week to get that back. Now we can do those tests inside the walls of Spectrum Health and turn those test results around in a few hours, or at most in a day. That's been very, very helpful in fighting the disease. But by far the most important is making sure you don't spread this to others. And it's more than just social distance, Ms. Fisher. It's about keeping our hands immaculately clean.
Yes.
About not touching our faces, particularly eyes, nose, and mouth. Making sure you're not sneezing or coughing on other individuals. And a lot of folks that pick up this virus don't know they were around anybody that was sick. They went shopping. You know, they handled a cart. You know, they were in a church service or a funeral and didn't know anybody else was sick. And they came home exposed, and 2 to 8 days down the road, they got sick. And sadly, too many of those folks have passed. You know, the overall case fatality rate of this, hard to judge that right now, but of the folks with confirmed COVID-19, there's certainly many that don't have confirmed tests, but of the folks that have a diagnosis of COVID-19 made by a test, the mortality rate is running 3 or 4%, which is just a tragic, tragic number. And we can make that go away if we prevent those social interactions that spread the virus.
Absolutely. Thank you for that. Bertha, is there a question that you may have for the doctor?
Oh, yeah. I keep hearing that we have, you know, tests available. They, you know, in the national briefings, nobody should be without a test if they need it. And yet, when you talk to local people or state people, they say we don't have enough tests to go around. And that concerns me because if you can't get tested, how in the world do you know that you have it?
Well,
I mean, I know the symptoms you talk about, but still.
It's a great question, and we have all suffered from the lack of tests. Now, initially, they had more tests, and they didn't have the collection devices, the swabs to do this. Now we've opened that up and have lots more tests in the country. We're still having a hard time keeping up with the swabs to do the test. But for instance, the state of Michigan, when they were testing, were able to test 200 a day. We now can test 600 or 800 a day just inside Spectrum. And we're trying to grow that number. So we have way more tests than we used to, but we don't have as many tests as some other countries where they have tested millions of their population. That will probably take us another few weeks to get that many supplies in our hands so we can test everybody. And your point is, how do you know? Well, a couple things. One is, the safest thing is to assume you have it and stay home. Even if we do a test, there is something called a false negative rate. A false negative rate means we did the test, but it didn't show that you had the disease. And sometimes you don't diagnose that disease for another few days or even a week. And so under those circumstances, you're still better, even if you don't have a diagnostic test. Even if that test is negative, the safest thing to do is make sure you socially isolate. You stay by yourself until 2 weeks after your symptoms have gone away. But no, I share that frustration. It's been frustrating to us all just not to have the supplies to do that. The federal government didn't open up for health systems to do the testing until about 3 weeks into this epidemic. And finally, they realized, we all knew this, they couldn't keep up. And we need the rest of us to do the testing. And even when they sent to the state, that was better, but the states couldn't keep up. You have to get in this into the hands of every hospital and laboratory in the country to have any chance of keeping up with the need for tests.
Okay. Thank you.
How Mrs. King, how do you see your community responding? And what can we do to help?
Well, I think the majority of the community is on board with trying to do whatever it takes, and especially in the community of Benton Harbor that I can speak more about, because we see ourselves across the country dying at a faster rate than any other race. And so I believe that the majority of people are trying to do what's necessary. On the other hand, there are a number of people who still don't believe that this is a reality. And those are the ones that we've got to try to reach as best we can, because they're the ones who are logically going to infect family members and others because they're not listening to what's being said.
So you hit the nail on the head. Our African American communities, our Black communities, are absolutely suffering more from this disease.
Yes.
You know, if you expose any race to this virus, they're likely going to get sick. But you're more likely to be exposed when you're living in a city, when you're living close together, when you're living in apartments. You know, the closer people are living together, the more likely this is to spread. And in the African American community, the Black community, there is a higher prevalence of some of the diseases, diabetes and hypertension and heart disease, that increase the mortality rate. The numbers in Michigan are striking. A Black individual has about 2.4 times the chance of having a diagnosis of COVID-19, more than double. And for those that get it, the mortality rate runs about 20% higher. Those are serious numbers and put our friends and neighbors at serious risk. And I completely agree with you. Most I've talked with, they understand this is significant. We have to be incredibly careful. But all it takes is a few folks, they're often younger, and those younger individuals just don't think they're going to be vulnerable. And if they congregate, it may not be them that get sick. They may give it to their parent, their grandma, their friends, their neighbors. And that's just the sad part. You might be behaving and somebody else might cross your path and give you COVID-19. And we just have to get the word out. If we just are very careful now, we'll save lives in this. There's no question about it.
Yeah.
So quarantining and social distancing is vital right now, because you said you could be behaving, but whoever you're around is not.
That's all it takes. You know,
I have to.
And often there are 3 or 4 or 5 living in a home, and all it takes is one of those individuals to go out and pick it up, and of course that entire home is exposed.
Yeah.
Okay, I have 2 questions here for you. One is, what should one do if they have a serious cough and it's off and on? Should they still come in for testing?
Well, so a lot depends on whether that cough is new or not. You know, if somebody has a chronic cough that's gone on for weeks, it's not likely COVID-19. If that cough is an acute cough, it just began, that's something you need to take seriously. Some folks with COVID-19 don't get a temperature. Some folks that get a temperature don't get a cough. But if you have a new cough that may put you and others at risk, you should call. Now, if you're living at home by yourself and you feel pretty well and you can socially distance, that risk is pretty low. If you're working in an adult foster care setting, or if you're working preparing food for somebody, or you're working in a grocery store stocking shelves, you need to understand whether you have COVID-19 or not, so you can socially isolate. And that might be self-monitoring or self-quarantining at home, where you're just not going out at all for a couple of weeks. That will help save lives.
Okay. What should individuals who tested positive do during the 14-day quarantine?
Yeah. Well, so whether you've tested positive or not, the most important thing when you're at home is to survive this, if you can, with mostly a smile on your face and a good attitude. It is hard to socially isolate. It's emotionally hard to do. It is frustrating not to be able to go out. It's frustrating not to be around your friends. You know, it's frustrating to not connect with the people that you care about. So whether you've tested positive or whether you have not been tested but are presumed to have COVID-19, social isolation needs to be complete. It needs to be all in for 2 weeks, which means you don't have people bringing you food. You're not going out grocery shopping. You're sending somebody else to the pharmacy and getting your medication if you need it, or somebody else getting you supplies. It's not getting in your car and driving around. It is really staying at home. Now, if you have space and you can walk around your house and not be around anybody else, you know, fresh air is not harmful for you, but you mustn't be around others.
Okay. How is Spectrum Health Lakeland collaborating with other communities to contain the virus?
Yeah, we are in constant communication at multiple levels. We have regular calls with all the health systems of any size in Michigan, and we're comparing notes. We're on the phone with folks from Henry Ford, from the University of Michigan, from Beaumont, from Trinity, from Ascension, several times a week, comparing notes on what they're seeing, what they're doing, how they're treating various symptoms, sharing knowledge back and forth. We also, within a community, are working with other healthcare providers, whether or not they're employed by Spectrum Health or not. Independent physicians, we're collaborating with nursing homes, with adult foster cares, with senior centers, with assisted living. Probably the most important collaboration is with the health department. The health department is kind of responsible for the community across the region. We're responsible for the health care across the region. They're responsible for helping ensure the health, particularly in the face of this kind of a disease. So we're collaborating with them also every day to try to lessen the burden of this disease.
What can we do in our own communities to help?
So please use your influence. And you are, Ms. Fisher. I really appreciate that. But everybody, use your influence to save the lives of those around you. If you're a pastor or a reverend or a bishop, use your influence to shepherd your flock. Use your influence to make sure those people you care about that are following your leadership are doing everything they can to prevent the spread. When you see behaviors that aren't consistent with what we should be doing, gently remind people why it's important, why this is helpful. The life they save might not be their own, but it might be somebody they really care about, their boyfriend, their girlfriend, their child, their parent, you know, somebody special in their life. Use your influence to help keep your community safe. I think that's probably the most important thing.
Thank you. I am always researching and trying different vitamin supplements and herbs to build my immune system. Is there something that we could be doing now? I know, of course, the rate of vitality because of the underlying health issues of the Black community. What can we be doing right now?
So that is a great question, and I'll give you maybe two answers. Okay. One is there's something everybody should do, including the Black community, to help take care of their own immune response. The vitamins and minerals, we'll come back to that in just a minute. Getting enough sleep. Rest is incredibly important to your immune system. Getting enough sleep, getting some exercise, getting out and walking apart from other people, 6 feet apart, but exercise, plenty of water is important. Those things all help build the immune system. In addition, staying away from sugar. Sugar is really hard on the immune system. If you're trying to prevent infection, you should not be having ice cream. You should not be having donuts. Things that are high in sugar are just not good for your immune system. This is a great time to be eating protein and fruits and vegetables, things that are lower in refined sugar. So that's kind of the lifestyle side that everybody can do, and incredibly important for you folks. Your listening audience, your viewing audience here. In addition, there are things that we think probably are beneficial. There are all kinds of vitamins you can buy, obviously most notably vitamin C, but all kinds of other preparations that are designed to boost your immune system. I would tell you just one thing. It is, and this is based on a lot of science, we probably can't unpack tonight. It is less important on what you do, and it is mostly important that you believe it with all your heart. And there's a lot of data behind that. That seems like kind of maybe a crazy statement. You mean belief might have something to do with my immune response? It has everything to do with your immune response. So if you pick up something and say, I read about this product, I think it's going to be beneficial, and we could list, there's hundreds. If you decide you're going to take it, believe in it, because that helps your immune response. Third, a positive attitude is incredibly important. I believe that positive attitude is something, it's sometimes hard to do at times like this because we're worried about our friends and neighbors. We're worried about our parents or our children or ourselves. But having a positive attitude, we know improves immune response and lowers the mortality of many diseases. This is not just about not getting it. It's also, if you get it, a better outcome. And so that positive attitude we know is beneficial. I'm part of a family of faith. There's a lot of data that people that belong to a family of faith have better outcomes. Now that I believe could be of God and a higher power. And it also is the emotional support you get from your family of faith, caring for each other, caring for a community, telling people you love them, telling people you care how things are turning out in their lives is an unbelievably powerful tool, I believe, in benefiting people's immune response and lowering the chance they'll get seriously sick.
Thank you. That was a good answer, and I'm sure that was acceptable to the viewer that asked it. And thank you guys for joining tonight. For you guys who have just tuned in, as you know, I am here with Dr. Loren Hamel and Mrs. Bertha King, and we are having a conversation, a community conversation about COVID-19 and what it entails and what we need to do right now. Everybody, all of us need to guard ourselves, pay attention to the signs, and follow the guidelines that the government has set before us. Is social distancing. If we want this thing to cease in our community, we have to follow the guidelines. So thank you all for joining us. If you haven't already done so, please share it, tag your friends and family, get this information in their hands. This is a privilege and an honor to have Dr. Loren Hamel spend his time with us this evening. So get this information in their hands. Thank you guys for joining us. How do we convince people not to meet in large groups?
This is just hard to do. I recognize people, they like to be around each other. I mean, this is just hard to do. It's hard for parents to be sometimes locked in small quarters with all their kids. Sometimes they want to get out of those groups. But for those of us that are alone most of the time, getting in the groups is just the way we are wired. And I would just say a couple things. At this point in history, that's what your phone is for. You know, that's what Facebook is for. You know, that's what Skype is for, or Zoom. You know, the meetings we're having. That's what those are for. I dial up with my family. I said I have 7 children and 9 grandchildren. We regularly are all on the computer screen all at the same time, telling stories to each other and recounting what our day was like. Our social interactions have just moved virtual. And so to the extent you have that technology, and most of us have smartphones, so we can do this pretty readily, use those, because it really is helpful. Can I ask my dear friend, Mrs. King, a question? Would that be okay, Ms. Fisher?
Oh, sure, absolutely.
She is an expert in positive attitude. She has a PhD in positive attitude, I believe. I might be making that up. But she fought a serious disease and teaches others how to fight serious disease. The lessons you learn from those kinds of fights are unbelievably important, and I think transferable to this kind of a fight. Now, that didn't involve social distancing, I get that, but it certainly involved attitude. I wonder, Mrs. King, if you might just share a little of your experience about how do you get a good attitude in the middle of really tough times?
Well, you have to recognize that God is still God, whatever impacts our life. He's still God, and he's still there for us. And we can call him whenever we need him. I tell people that I have faith by choice. Nobody made me have faith. I have faith because it was important to me to know that there was somebody bigger than my situation, somebody bigger than diseases, somebody bigger than even the coronavirus. There's somebody bigger. And I'm saying to people that we're the prayer warriors, those of us who have faith, who stand in the gap for those who are victims and for those who lose family members. It's our responsibility to sound the alarm in our community in order to reach those who choose not to participate in these life-saving decisions. We're the stakeholders. We're the ones who live by faith and serve with action, love, and truth. We are the world, and whether we like it or not, the world is in our neighborhoods. And we've got to stand on a principle. There are people who say, well, nobody can tell me not to go to church. Let me tell you what I've been learning while we've been outside of the church walls. I've been finding out that inside my house, I'm learning to face God more every morning than I ever thought I was before. I'm learning to get my scriptures, to read that word, and to pray harder than I've prayed before. And before I go to bed and get on the phone and call people that I haven't talked to in a long time to say, how you doing? Be encouraged today. That's what we've got to do. Perhaps in this moment, in time, there is a deeper reason that we don't even understand that we're in this place and this time. And because we're here, we are not here to give up. We're not here to be fearful, but we're here to prevent. We're here to make a difference. We're here to use our faith to accelerate what God has meant for us to be.
Amen.
Amen to that. Awesome. Are there any questions, Mrs. Bertha King, that you may have for the doctor?
Yes, there is. I want to say that it was thought that young people were not as vulnerable as others. And we're discovering now that a number of young people, even some babies, have contracted the coronavirus. What is it that we're doing here in our community to share what is Lakeland doing in particular as a healthcare system to target the younger individuals.
Can you pardon me 1 second? I have a phone call that I just must take, and I'll come back to that, and I'll tell you why here in just 1 second.
Okay.
All right.
Thank you guys for joining while he is taking a moment to step away. Please share this video. Please get this in the hands of your loved ones, your grandmas, your aunties. If you are home with them, please invite them to join you and hear this conversation that impact our community, impact our loved ones, impact our families.
I'm sorry for that.
Jerry said, sound the alarm. Absolutely. Absolutely.
I'm sorry for that interruption. I need to explain myself. My twin brother, Lowell Hamel, is in the hospital with COVID-19 and was quite sick with COVID-19. And he just called me on the phone. And so I thought I should take that and get an update on how he's doing.
Yes.
He has had a lot of folks praying for him, and he's been very sick. But that was important for me to just duck right. It's hard to get a call out of the hospital sometime with all the contractions, but thank you for that consideration as I stepped off your broadcast here for a minute. Could you, Mrs. King, repeat that question and I'll address it?
You're asking me as senior to repeat a question?
Or make one up. Okay.
No, I was saying that, early on it was thought that young people were not as vulnerable as older people to the illness. And I wanted you to talk about why we now know that young people need to adhere to those public health guidelines.
So what we know is that as a group, young people don't suffer as much in terms of hospitalizations or ICUs or ventilators or death. Markedly less chance of getting very sick. Now, there's some children that have died, some young adults that have died. Most of them, not all, have other immune problems. They have, or other lung diseases like asthma.
Okay.
And so often there's something else that makes them more vulnerable. Children are not exempt from getting the disease. They are every bit as susceptible to catch the disease and pass it on to others. And if they have chronic conditions of any kind that interfere with their immune response, they're more likely to get sick. But when you look at the distribution of age on who gets sick and the distribution of who dies, it's heavily weighted towards seniors. But young people can get it. And of course, they can pass it along.
Okay, thank you. What is the role of the local faith communities in response to the crisis from your perspective?
Oh, well, now you opened a big door there, Mrs.
I know.
All right. So can I take my physician hat off? No, that's part of my physician. So let me share my own view on this. I believe we, as humans, as parents, as friends, we're put in this world to take care of each other. We're put in the world to help be miracles for heaven. And those miracles don't just happen in churches, and they don't just happen with pastors and preachers. They happen when community reaches out and loves each other and cares for each other and does everything they can to make others' lives better. And that's part of living your faith. And I believe that matters. I believe it helps make people well. It just doesn't help make them feel better. It makes them healthier. And so this is just I believe, an important time to just live that faith, all of us. And you said it so beautifully, Mrs. King. I mean, that is you even not being in church, which is a hard thing for folks that's part of their weekly routine. But you can find that faith, you can find that spiritual connection, And I believe you can be part of those miracles right from your home. Pick up the phone and encourage people. You know, tell folks how much you care about them. Help find ways to distract children, which is particularly hard when they're out of school and all at home. You know, they're off at the playground, bringing each other's germs back to their parents and grandparents. That's hard work for a community. Help figure out how we can make that more entertaining and more educational and more enjoyable. And that's things that folks out of a community of faith, I think, are pretty good at, and I think can help their community with.
That's good. That's good.
You opened the door.
Yes, he did. Yes, she did. So I want to reiterate some information, reiterate the question, and put some emphasis on the diseases that impact COVID-19 with African Americans. Mm-hmm. So some of the diseases, the major diseases that affect the underlying issues that affect the outcome, the results of contracting the virus.
Yes. And
the fact that now this has hit home for you, which, if I'm not mistaken, I believe I read that it's a twin brother. Mm-hmm. Mm-hmm. And so being that this is now at your doorstep, how important if you could convey to my viewers from it being at your doorstep, how important this is for them to take care of themselves and to follow the guidelines of the CDC and our government, our local government.
That is such an important question. And, we're all wired a little differently. There's some folks that they follow every rule. There's some folks, they break every rule and have since they were children. That's just normal in a community. It's normal with a population of people. But if there's ever a time to listen, if there's ever a time to act, if there's ever a time to use your influence to help others act, this is the time. Because the community's impact or the community's efforts will absolutely, positively save lives in their neighborhood. This is not put something in the offering plate and help somebody a world away. This is doing something tangible in your own community with your own behavior that will absolutely save lives. And the challenge, if we don't do this, is we're going to lose some of the most precious, the most wise, the most helpful members in our community.
Will you repeat that again? If we don't, we're going to lose.
We're going to lose part of a generation that are the folks that are some of the most wise, some of the most helpful. Yes. Some of these are that's the fabric of our community. We cannot stand to part with those dear resources in our community. So, those are the folks that are suffering most. And so the lives we save will be in our neighborhoods. There's no stronger statement I can think of is that you may save life in your family. You may save a life in your neighborhood. Yes. That is a war we want to win as a country. That's a war we want to win as a community. And we can, if we just do it with all of our hearts.
Absolutely. Absolutely.
Betty, I want to say something, if I may.
Yes.
People in our state, county, and community have the disease. People.
Yes.
Most have died without their family by their side. Family members are unable to visit their loved ones who are ill, those who are sick with the virus and cannot attend funerals due to the COVID-19 crisis. Don't put your family and friends at risk by ignoring the warnings. Save your parties. I know you want to have a birthday party, you want to have a wedding, you want to have all types of celebrations, but let's wait until the coronavirus has been dealt with. This is not about fear. This is about wisdom, prevention, and safety. We want to see our children, our parents. I want to see my grandchildren. I want to see my relatives, and I want to see my church members beyond this disease. And you know what? By listening, by cooperating, by supporting and getting through this separation, it's going to mean a greater love when we see one another and when we're able to really have that party together with the world. And I'll say it again, the world is in our backyard. You got to help us spread the word to your family, because if we love them, we got to tell them the truth.
Absolutely. Absolutely. So in closing, Dr. Loren, one question for you, and then what do you want to leave in the viewers' thoughts and put in their hearts? How long do you think we will have to deal with this in our community? What's the prediction?
So yeah, so you've probably all seen the models, and they show these exponential peaks in cases. And we've done the models. I'm at Spectrum Health Lakeland, and there are about 15 variables in that model. What I can tell you is this: the better we are as a community, the more lives we'll save, the lower the peak is, but the longer by a bit it will last. Now, that's all important. More lives will be saved. We will lower the peak, so we won't exhaust all the healthcare resources. We're able to care for our friends and neighbors, but the longer it will last. So instead of having this great big peak of cases, it's slower and lower. And you know, most folks that are doing the modeling suggest this is not going to be weeks. This is going to be a few months. Now, it might come back. We might have another go around in the winter, you know, or the virus might mutate and be harder to treat or control. We don't know those things at this point. But in the communities that have done this the best, they don't get these big sharp peaks. And it's a much lower prevalence of disease. And of course, much easier then to do the social isolation, to treat the people in hospitals that need it, and to get better. So it's a great question, but my prediction is not a few weeks, probably a couple of months.
Okay. Before this curve is flattened and stabilized.
Yeah, that's what we're trying to do, is flatten the curve. You know, Ms. Fisher, I thank you so much for inviting Mrs. King and I onto your virtual broadcast here. It is a pleasure to meet you and a pleasure to speak with your audience. You know, dear people, hopefully caring about their friends and neighbors as well. I'm delighted to spend a little time with you. Thanks so much for the invitation.
Likewise, it's been an honor. So any closing words? That's what you want to share? Anything you want to leave with the viewers?
All right, well, we love you all. We want you safe. We want you alive.
Yes.
No, we want your friends and neighbors alive. So please, please, keep your hands clean. Keep your hands away from your face. Use a mask when you go out, even if you have to make your own. Scrub your hands when you come back home. Do all the things to keep the germs off from you. And of course, stay at least 6 feet from everybody. If you do that, it may save your life. And that means everything to us.
Yes.
Thank you so much. Thank you, Mrs. Bertha King, for being here. You guys, thank you for joining us tonight. Please share this. Thank you, guys. Good night. Good night. Thank you so much.
Thank you.
Yep.